The objective, as first laid out by the collaborative several years ago now, was to improve access to health services for young people in this province. Integrated healthcare begins to address that issue by not only co-locating services under one roof or behind one door, but by encouraging those services to work together so that youth don't feel like they have to repeat their story again and again. In effect, what you're doing is creating a community of resources, a community of services for young people to access and to feel as though they are supported by a community. That, in essence, is the spirit of the collaborative.
We're really looking at a system of care. And oftentimes when the dots don't connect or the pieces don't connect, what it happens is that it really means that people, A, don't get access to the services that they need, ultimately are at risk of falling through the cracks. And what we know is if they don't get the services or that happens, they're likely going to be picked up in other areas, such as criminal justice. They're going to show up on the streets in terms of being homelessness. So there's going to be a cost borne out to society, both a financial cost as well as a social cost when people don't get the care that they need in a manner that's seamless and integrated.
What we know is that outcomes for youth and their families are far more positive when we can wrap the services that they need around them in a way that's easily accessible for them.
About 4 years ago, I was a college student studying the liberal arts here in the Lower Mainland, and I wasn't very good at budgeting my student loans, and I also was using a lot of cannabis, and as a result I became homeless and began suffering from psychosis. One day, a mental health outreach doctor named Dr. Bill McEwen came and discovered me and referred me to the inner city youth team. The first thing they did was get me out of the downtown east side, and they began having me work with a psychiatrist and tried to get me to start taking some medication to help resolve some of my symptoms. And I was resistant to that at first, but eventually I was able to start a regimen of intramuscular medication that instantly resolved my symptoms. I had been suffering from grandiose delusions and hallucinations for a year, and within a week or two of starting my medication, I was healthy again. The first thing that happened after I started to get better was that they moved me into some better housing. And eventually I was able to start going back to college, and I started volunteering. I doubt that I would ever have been able to go back to school. When you're living in that world of delusions and hallucinations and voices, you don't have the ability to function at the same level as a person who doesn't have that disability.
I think that the schools, because we see the kids all the time and we house them for so long, 8 hours a day for 5 days a week, we are kind of a hub, and we're able to act together with other agencies to best support our kids. For instance, with one student who was having a lot of problems, we were able to have our CMP, social worker, physician, and school all at the same table to help put that safety net and build a plan together.
The future of healthcare is really in integrated care. It's when all of us come together and we break down those barriers and those silos of different professions, thinking about the healthcare system versus the school system versus the police, and we kind of forget about all that stuff.
The importance of integrated care is really the partnership. How do we actually take an integrated approach to looking at the services from a youth and family lens? So if we work collectively together in youth hubs, we work collectively together in hospitals, we work collectively together in intake, screening, support, services, community partnership. That's what we're talking about.
The profession, again, for me, is about people, communities, society. That's why I went into medicine. And it's so great to see that that's where healthcare is moving, and in particular this collaborative is moving. It's the future of healthcare, I think. It's the right step, it's the right direction to be going.
I'm doing really well now, and I'm so thankful for all the help I received. I lost 3 years of my life to psychosis and subsequent illness. And those were 3 years when most young people are completing their degrees, beginning their professional careers, and I was stuck. And I was able to go back and get my life trajectory back where I needed it to be.